Good day, everyone. I am Ariel Tintinero, and in behalf of my co-authors, I will be presenting the second part of a master's thesis entitled The Role of Starter Diets on the Development of Exercise-Induced Haemal Lordosis in Zebrafish, Daniel Hamilton, 1822. The early use of starter diets in Fil-Fish larva rearing has now been practiced by commercial hatcheries for two main reasons. First is to lower production costs, and second is to enhance juvenile quality. However, formulation of feed that has a nutritional requirement appropriate for fish is difficult. Thus, the imbalanced amount of nutrients in the diet may result to the development of skeletal abnormalities. These morphology abnormalities have negative effects on fish. First is on product quality as it affects the external morphology of the fish as well as the consumer perception on aquaculture products. Second is on other quality aspects such as on growth, the feed conversion efficiency, as well as mortality. Third is on the production process as it affects the hatchery productivity, production, and sales management. And last but not least is on the animal welfare as this morphologic abnormalities reduces the tolerance of the fish to stress, making it susceptible to diseases. And one of the most common morphological abnormalities in fish is the Haemal or the V-shaped curvature. This axial abnormality develops during the late metamorphosis and juvenile period of the fish. This is mainly attributed to the intense swimming effort of fish with inflated swim bladder. However, there is an information gap on how larval nutrition affects the development of this abnormality in fishes. Hence, the main objective of this study is to examine the effect of three commercial starter diets on the development of exercise-induced Haemal in zebrafish, with three specific objectives. One is to determine the incidence of lordotic fish between diets. Second is to determine the intensity of lordosis and the number of affected vertebrae between diets. And third is to determine the center of lordosis between diets. But why zebrafish? It is mainly because zebrafish is a model species for biological research due to its small size, high fecundity, rapid external development, optical transparency, and it is easy to handle. In aquaculture, it is a beneficial model, but it has the same ontogenetic pattern with common aquaculture species such as sea bream and sea bass. Hence, all the experimental procedures involving zebrafish in this study were performed in accordance with Greek and EU legislation for animal experimentation and welfare. All protocols are approved by the Animal Care Committee of the Belgian Department of the University of Lviv. In this study, the fertilized eggs were collected from a common wild-type zebrafish population maintained in the University of Crete, and these eggs were randomly divided into three experimental groups with 250 embryos per experimental diet and replicate. This study was done in three replicates. In terms of egg incubation and larval breeding, it is done in the three cubic head pens positioned into a common aquaria connected to a biological filter. In terms of breeding condition, temperature, pH, conductivity, and oxygen saturation were checked daily, while the nutrient compounds such as ammonia, nitrate are done in weekly basis. In this study, three commercial starter diets are used, and they are coded as A, B, and C for confidentiality. A and C are both zebrafish specific with different size, while B is specific to marine larvae. In terms of PD, it started at the fourth days post fertilization. So at 4 to 7 day, they are only given with Artemia nuclei. In 8 to 11, it is combination of Artemia nuclei and dry feed. While after the 12th and the 20th day, they are given with dry feed only. At 20th day post fertilization, 20 juveniles measuring around 11 to 12 millimeter in total length without any gross abnormalities or without lordosis and scoliosis were selected for the swimming challenge test. The swimming challenge test used in the study follows Prince et al. 2019. So the fish undergoes continuous swimming for 4 days at 8 total lengths per second. They were only fed 3 times per day during short water cut-off for 15 minutes. Per replicate, swimming test was done simultaneously. After 4 days of continuous swimming, individuals were then euthanized, stained, and photographed under a stereo microscope, examined for the presence of Haemal lordosis. Lordosis angle was then measured using the TPS Dig2 software. Each of the feed were then analyzed for proximate analysis, looking on the ash, the crude fat, crude protein, phospholipid, and natural lipid content. For statistical analysis, we used the G-test to check the differences in the normality rates among the experimental groups. Now, to answer our first objective, we observed a significant increase in the frequency of Haemal lordosis in group B and C compared to A. And I want you to remember that A and C are feed specialized for zebrafish. To answer our second objective, no significant difference in the intensity of lordosis and as well as the number of affected vertebrae between groups were observed. Interestingly, we observed a common area of Haemal lordosis center for the fishes with lordosis in the three diets. This presence of common area might be associated with the differentiation of the muscular loads along the vertebrae during the swimming exercise. And this area of lordosis center is actually observed in sea bass and sea bream in other studies by Kihara et al. 2002 and Stikiniakis et al. 2006. Prince et al. 2018 reported that Haemal lordosis is associated with the folded end plates at dorsal part of the vertebral body of the fish due to intense swimming. In addition, result of the proximate analysis showed that Group A, which has the lower incidence of lordotic fish, presented higher phospholipid contents. The fatty acids, which include the EPA, DHA, often included in the phospholipids, are actually crucial for the early skeletal formation of the fish. This might suggest that due to the early skeletal formation, it lessens the incidence of lordotic fish in this particular group. On the other hand, we found out that around 48 to 67% of the lordotic fish observed in this study simultaneously presented scoliosis, and this might suggest that both abnormalities have a common mechanism of induction. However, further studies are needed to prove this claim. In conclusion, the development of Haemal lordosis in zebrafish juveniles were significantly affected by the dry feed provided. In addition, earlier vertebral column formation or mineralization due to the dry feed increased the resistance of fish against exercise-induced lordosis as presented in this study. However, differences in abnormality rates might be attributed to other feed characteristics such as crumble diameter, color, palatability, and digestibility, which was not included in this study. Overall, this study provides a strategy that combines swimming tests with nutritional tests to identify critical nutrients for bone development. I would like to thank Erasmus Joint Master's Degree in Aquaculture, Environment, and Society Plus for the financial support. I would also like to thank my co-authors, Dr. Humanduros, Dr. Fragolis, Dr. Kirkota, for the fish husbandry as well as on the analysis of the skeletal abnormalities. And last but not the least, I would like to thank the Erasmus Mundus Aegis Plus Cohort 5 for the experience and the friendship. That would be all. Thank you very much.